Good afternoon. It's a great pleasure for me to welcome you to this seminar on a global mapping of the use of expertise in the management of COVID-19. I'm Valsamis Mitsilegas, and I'm here in my capacity as a member of the leadership team of the Queen Mary Global Policy Institute, which hosts this seminar. I am delighted to be chairing this seminar today, which brings together a stellar research team and an outstanding panel of experts to discuss the pressing issue of the use of expertise and evidence-informed policy in responding to the pandemic. I'm also here in another hat, so I have a double-hatted role. I'm also the chair of a working group convened by the Queen Mary Institute for the Humanities and Social Sciences on responses to COVID-19, and Dr. Ladi is an active member of our group. So the event also bridges, if you like, not only policy responses, but also disciplinary approaches to the responses to COVID-19. So I'm very much looking forward to our discussions today. And without further ado, I hand over to Professor Colin Grant, VP International for Queen Mary. Colin.
Thank you very much indeed, Professor Mitsilegas. Good afternoon, good morning, good evening to all, depending on your time zone. I very much hope that you and yours are well. It gives me very great pleasure to bid you welcome to this latest global seminar under the auspices of the Queen Mary Global Policy Institute. And may I extend a particularly warm welcome to our eminent panelists. Bringing together expertise from such varied geographies lies at the heart of the mission and ethos of the Institute. Thank you for sharing your insights with us. Kamsahamnida, Ngiabonga Nkosi, Asante Sana. I would also like to congratulate the team led by Dr. Stella Ladi, Dr. Dimitra Panayotatou, and Dr. Angelos Angelo in the School of Business and Management. The report, a global mapping of the use of expertise and evidence-informed policies in the management of the pandemic, is comprehensive, covering data from 24 countries. It is a timely intervention in our altered world, a world in which trust in the political process has acquired new vulnerability, a world in which experts have been dismissed and then quickly rediscovered when not fake remedy, not myth or denial, but science was recognized as the key to combating the pandemic, and a world in which truth itself seems to have become negotiable. The Global Mapping Report will make publicly available a database on how governments around the globe have employed expertise and evidence-informed policies to combat COVID-19, and it will address key questions on evidence and the virtuous circulation of ideas between policy and academia. I eagerly await the discussion and make way for the chair. Thank you. Balsamis.
Thank you, Colin. So I think without further ado, we are all looking forward to learning more about the findings of this project. I will hand over to Dr. Ladi and her team, Dr. Angelou and Dr. Panayotatou. Please. You are on mute.
Of course, I am on mute. Thank you. Hi. Hello to everybody. Thank you very much, Valsamis and Colin, for the opening of the event, and to all our distinguished speakers from around the globe. This is really very nice for us that you agreed to comment on our initial findings. Of course, we would also like to thank the Global Policy Institute and the team there for making this project possible and for supporting us all the way through. So I will just start by introducing a little bit the project, and then I will pass it to Dimitra and Angelos to show you the interactive map that is now live, and to talk about some of the initial observations that we're making about the use of expertise in the policy making during the COVID-19 pandemic, as well some takeaways for policymakers, at least what we thought up to now that is important. Of course, this is also open to discussion with you. So if we can have the next one, please. So we thought that rather than just having a report about the findings of the research, it would be good to present it in a more interactive way. So we decided to create a database showing how governments around the globe employed expertise and evidence-informed policies to combat COVID-19. Of course, we could not cover all the countries, so we selected a few, and we'll say a few words about the methodology in a minute. So we selected 24 countries, and we created this database that will stay available publicly, trying to answer how scientific evidence fed in the policy process and how it informed political decisions in different systems, in different political systems, in different policy circumstances. Our aim is to contribute to the dialogue between academia and policymakers, because we think that the COVID-19 pandemic, as also Colin mentioned, is also an opportunity to rethink about this relationship, since nothing could have happened without the experts. And I'm not talking only about the medical experts, but also about social scientists, behavioral scientists that have been informing governments all the way through. But this is not happening in the same way all around the globe. And we really think it's important to outline that in order to foster a dialogue and to see how we can better do that in the future, since we are sure that there will be different crises that we will all have to face, and even this pandemic has not ended. So the idea is to facilitate lesson drawing between the different countries, the different systems, and to exchange best practices. And if we can move to the next one. So the questions that we are asking, and we will show you in a minute, was what happened in the different countries? Where did expertise come from? Do we have institutions and bodies providing expert knowledge to the policymakers, that they are autonomous, or did this happen within the governments? Were these institutions or bodies ad hoc, or were there permanent ones? What type of expertise was used? So what kind of disciplines were involved in informing policies? Who was responsible for the final decisions? Who received the expert input? And was that clear that the responsibility lied with the government? Then how was expertise communicated? So we try to find out whether experts actually participated in the communication strategy of governments, or whether they were kept in the back, and what seemed to be more effective or not. What was the role of the regional and subnational levels in the translation of expertise into measures? So did they have, did their subnational or regional level, depending on the system that we are looking at, had the opportunity to create their own policies, looking at the expertise, or were these decisions centralized? And finally, we convened surveys in 4 countries about the way public trust was impacted by the use of expertise. We are not going to show the detail and more quantitative data that we have on that yet, because this is still under review. But we're going to discuss what we have found up to now in the different cases, and more will follow, of course, in publications and in the future. I think I will now pass it to Dimitra, that can show you the map and explain a bit more. So welcome, Dimitra.
Hello, thank you, Dr. Ladi. So here you can see this interactive map. We decided to present our database in a user-friendly manner. It is quite easy to use. First of all, this database and map is available through the Global Policy Institute website. You only have to go under projects, and then you will find the COVID-19 interactive map. It is quite easy to use. You can see there are some pins. You just go there, you click on one, exactly. Let's go to Italy, and then you will have an overview of this country regarding the management of the pandemic, of course, and then different questions, the ones that Dr. Ladi mentioned before. and some information. These categories are applicable to all countries, of course, all 24 countries. And I would like also to discuss a bit our methodology and data collection. First of all, as mentioned before, the database covers 24 countries from across the globe with diverse economic conditions, governance regimes, and levels of public trust. So the selected cases also cover the full performance spectrum with respect to pandemic management, meaning that some countries performed better than others. This was one of the criteria for selecting these cases, and also provide a diverse set of illustrative cases that encourage further single case or comparative analysis. So what we did basically is to select typical cases of distinct broader categories in order to ensure more or less the generalizability of our findings. Regarding the data collection, we used both primary and secondary sources. So material has been drawn from official documents issued by the governments under examination, international organizations' reports, for instance, reports from the OECD and the World Health Organization. We also consulted other similar databases related to the management of the pandemic, for instance, the Covid-19 Global Response Index and OECD's Steep COVID-19 Watch. And we also used some well-regarded media and academic sources to find some information on particular questions. These are some information on methodology, and I would like now to move on to start discussing our key observations. First of all, the first one has to do with advising versus implementing bodies. This means that there is a clear distinction, usually in most countries, regarding the bodies that provided expert advice and the bodies that implemented policies. So we see that from our sample, most countries drew clear lines between policy advice and policy implementation. Indeed, most have established advisory bodies with little to no executive power. This is around 80% of our sample. We have very few cases of mixed competencies, meaning that they both provided advice and also were in charge of implementing policies. We see here the Korean Disease Control and Prevention Agency, as well as the Russian Federal Service for Surveillance on Consumer Rights Protection and Human Well-being as the most prominent examples. And to conclude, there is basically no evident connection with how governments used expertise. At times, they might ignore expert advice when the division is clear, for instance, Brazil, or they can follow closely even when division is unclear. Here we have the examples of South Korea and Taiwan. So moving to the second observation, we have a distinction between permanent versus ad hoc expert bodies. So bodies that existed prior to the crisis and bodies that were created specifically for managing the pandemic, the COVID-19 pandemic. So what we have here is that most countries employed either permanent bodies of experts or a mix of both permanent and ad hoc expert bodies. It is around half in each category, 46% in particular. Very few countries base their responses on newly created ad hoc bodies of experts. Here we have, for instance, the examples of Greece and Argentina. In all cases, expert bodies had to change their modus operandi and undertake new tasks and responsibilities during the health crisis. And what we can say is that there is no evident relationship between the type of expert body and whether this was permanent or ad hoc, and the proneness of the government to take expert advice into account. A final point worth mentioning here is the extreme examples of Brazil, where well-respected research institutes were not really able to make the government take into account their advice, as well as Greece, which basically is a country with little tradition of expert advice in government, but which during the COVID-19 crisis followed closely the advice of experts for most part of the pandemic. Moving on to the third observation, another question that was raised was what kind of expertise was used. Of course, we know that mainly medical and health professionals were employed, but we see some countries having also a multidisciplinary approach regarding expertise. So moving to our bullet points, a clear majority of governments employed multidisciplinary expert bodies comprised of not only medical experts, but also economists, data analysts, social scientists, behavioral scientists, communication experts, and many more disciplines and expertise for more disciplines. Yet there is no doubt that a big share gave a primary role to medical experts. Around 25% adopted an almost unidimensional approach based on the advice of solely medical experts, while a smaller share adopted a truly comprehensive multidisciplinary approach. What is worth noting here is that some of the top performers, for instance, Australia, New Zealand, really adopted a comprehensive multidisciplinary approach and did not only rely on medical expertise. And to close with the advice on sanitary measures, what we can draw here as a conclusion is that advice on sanitary measures needs to be complemented with input from other disciplines to work effectively. So I will let my colleague, Dr. Angelou, to continue with the presentation.
Hello, I hope you can see me. So moving on, this is the fourth observation out of 5. And this particular actually question has to do with what was the role of experts when it came to the presentation and the discussion of measures in front of the public eye, which is actually one can think of being very important for the compliance vis-a-vis the measures. Let me clarify here. Here we're not really seeking to see whether communication experts were actually involved with the presentation of the measures, but whether actually medical experts, the sanitary experts that really actually advised on sanitary measures, were actually involved in the communication campaign. And indeed, this was the case with a good actually part of our sample. So around 58% of the governments chose to actually place medical experts really at the center stage of their communication strategy to first of all present the sanitary measures, the restrictions, and also to analyze the rationale behind these measures. And just a point here on the literature. So indeed, this is very much in line with the expectations we have from the relevant literature. Experts are usually seen as actually messengers of credibility when it comes to policies. They are seen by the public eye usually as better able to establish the validity of certain policies and actually increase the legitimacy of these policies. So, you know, this actually has really important implications for compliance with measures, right? I mean, a minor point here that we're not sure it's important, but actually we found interesting is that there's actually a clear geographical distribution here, right? So in the case of EU countries, we actually see this as a very common strategy to use experts as the main messengers of the communication strategy. Having said that, this actually has to do mainly with Western and Southern Europe. We don't really have many countries from Eastern Europe in our sample. This is not to say that other countries did not actually use this strategy, but again, this is actually something we really see within the EU. Now, when it comes to the countries actually that actually did not use medical experts as, you know, the main presenters of these policies, so they actually let the political leadership kind of present the measures and the rationale. There we actually see a recurring emergence of disagreements and divergences of view between the experts that actually would provide the advice and the political leadership. So there were some actually salient disagreements that would came like in the public eye and would, you know, in a way undermine the messaging and potentially compliance. So, you know, there's this risk that when you actually do not really involve and consult the experts when it comes to the communication of the message, you might actually have public disagreements coming out. Moving to the next slide. So this has to do with what Stella said at the very beginning, having to do with the central and the periphery, like the central level and the subnational level of governance. And here what we try to actually see is whether actually the subnational levels of governance, the regional or the local authorities, had their own source of expertise, and mainly whether they actually were able to kind of interpret this expertise into tailored measures that were applying to their local regions, right? And I mean, indeed, in many ways, there was a crisis that was actually managed by regional and local governments, by peripheries. So it's around 58% of our sample that actually had substantial executive power, but also actually, and in particular, they had to kind of translate expertise into policy measures at the local level, right? So the source of this phenomenon actually is twofold. The first one has to do with institutional and constitutional arrangements that were in place prior to the crisis. So in many cases, actually, regional governments were entitled and were actually responsible according to the constitution to kind of have their own healthcare system, to have their own input on the issue, and to really manage the healthcare, the sanitary crisis on their own. So they had kind of their local experts, and also, they received expertise from the federal level as well. Though the other reason why actually we see this phenomenon being so pronounced during the crisis has to do with blame avoidance, right? So you actually see federal governments trying to kind of alleviate responsibility and move the burden to the regional governments, because this crisis actually really entailed measures that were not really desirable for many citizens. So in Russia and the United States, the governments actually made an intentional effort to really move the bucket towards the regional government, so they could actually take the really harsh measures of restricting movement, of closing down businesses. As one would expect, when you have this kind of confrontational strategy, you do have actually salient disagreements coming up between governments at the central and the local level, and you have clashes over the division of resources, but also, how you interpret expertise, and at the end of the day, what kind of measures you should actually take, and more importantly, which is actually what we saw, is when you should actually start the confinement and relaxing the measures. So, coordination is key here, between levels of government, but also between experts at the different levels of government. And this is something I'm going to come back later on. So those were actually our 5 observations. And now moving to the last 2 slides. The first one has to do really with the academic output we expect to have out of this database. So really kind of, what is our research agenda after this database went live. The first one has to do with our effort to kind of link the different types of expertise and the modus that the different governments use to employ expertise, to see if this is somehow linked with their performance during the crisis. And this is actually quite a multi-level analysis. It has to do with what types of expert bodies you have, ad hoc or permanent, whether the expertise was centralized or decentralized, but also what kind of disciplines you had involved in this whole effort. So this is something we're going to work a bit, and those are my first 2 bullet points. And then, as Dimitri actually hinted at the very beginning, we also have commissioned 4 public opinion surveys in different countries, trying to kind of shed light on how evidence-informed policies during crisis can really actually enhance public trust towards the government, also towards experts. And this is something that is really under wraps at this point and under analysis. This is kind of the academic part. And my last slide has to do with what Stella said as lesson drawing for policymakers in the very beginning. So we have actually 4 lessons from an initial review of our data. The first one is mainly a normative point that I feel it's kind of obvious for most people. You can actually use and employ expert advice and guidance, but I think we all agree from what we saw that the government should actually remain at the center position and should actually take the final decision what measures will be taken. And this database is not really about outsourcing decision making to experts. It's really involving in this, and this is kind of the first point. The second point is more of the substance. And it has to do with the type of disciplines that are used to actually inform policies. So in our analysis, it seems that when multidisciplinary bodies of experts are used, they provide more comprehensive and efficient advice that covers kind of every part of human behavior, making the measures that the government take more efficient and increasing compliance. I think it's a fair point to say that this is very important to actually ensure the resilience of the crisis management policy. So it's a very different thing if you have a crisis management policy that will apply for just 1 month and then for a year or a year and a half, like this is the case now with COVID. So, we feel that multidisciplinary approaches actually work better in the long term. The third point has to do with how you actually can use expert advice and experts as messengers for your crisis measures. So we see that when experts are kind of in the center of the communication campaign, they can deliver a credible and very much welcome message from the citizens and hence increase compliance. So, though a caveat that we should actually always keep in mind is that the credibility of experts should be safeguarded. They should not be instrumentalized and kind of shown as following the government's political agenda. This has been the case in some cases. So, this strategy has its limits and there are certain caveats that should be followed. The final point has to do with what I already actually talked about when I was talking about peripheral and central governments, right? So, I mean, in these systems, it's very important to actually have coordination instruments and mechanisms between the central level and the local level. And this applies not just between the government at the central level and the government at the local level, but also the experts at the federal level and the experts at the local level. So, having a consistent message, a coherent message, and kind of clear guidelines and advice that are communicated both ways. In our views, it's very important and kind of also limits the possibility of having disagreements between the periphery and the central government. And I think that's it from my side, at least, and for the presentation in general.
Thank you. I take it as a cue that we will continue now with the presentations. Thank you, all three of you, for such a wealth of information and insights. It has been really great to listen to your findings and to the potential ways forward. And it is interesting to discuss areas of diversity, but also areas of commonality. And to do so, we have four outstanding panelists. We're very honored that all of you are here to share with us your insights from how you have dealt with the pandemic at national level. And I will start by introducing Mr. Kim Yoon-young, who is Deputy Director of International Cooperation Bureau at the Ministry of Science in the Republic of Korea. We are very grateful for you for being here, also in view of the time difference. So I will give you the floor now, and I know that you probably have to leave after your presentation, so I will give you the floor, and then perhaps we can open to any questions that the audience may have before we let you go. So thank you very much. The floor is yours.
Thank you for inviting me to this webinar. My name is Yoon-jung Kim, and I'm Deputy Director in International Cooperation Bureau at the Ministry of Science and ICT. My presentation today is on how the Korean government has responded to the COVID-19 outbreak by focusing on science, technology, and ICT. Korea has been responding to the COVID-19 outbreak with quarantine efforts represented by the 3T, which means fast testing, tracing, and treatment. At the same time, social distancing measures of several kinds have been taken. Today, my presentation is about the roles science, technology, and ICT have come to play in testing, tracing, treatment, and social distancing. Korea faced various challenges and difficulties caused by COVID-19. On April 22nd this year, the number of new daily cases reached this year's peak. The number of new daily cases has been stabilized by proactive and transparent measures from the government and citizens' voluntary participation and engagement. Korea started to implement widely COVID-19 diagnosis tests for a short period in the early days of the outbreak. Korean government has supported the development and rollout of test kits by providing companies with R&D support for medical devices and fast approval. 7 companies received the emergency approval for their COVID-19 test kits. Also, AI-based medical image analysis specialist Lunit made AI learn large volumes of chest X-ray photo data to develop technologies that can abnormal long conditions of COVID-19 patients in just a few seconds. Such devices can be connected to portable X-ray equipment in COVID-19 screening centers or ambulances. And Korean Electronics and Telecommunications Research Institute developed a real-time biosignal monitoring system by receiving R&D support from our government. The system can be used in certain locations in hospitals or remote areas where medical staff is rarely dispatched so that patients can check their biosignals following instructions from medical professionals. The signals are monitored by medical staff in real time. The Korean government has developed self-quarantine safety application to efficiently support people who are in self-quarantine. The app has three main features. First is self-diagnosis, meaning that the users can do the diagnosis themselves with the app and submit the results to public officials in charge. The second is GPS-based location, which helps prevent possible violations of self-quarantine orders. The third is providing necessary information, including self-quarantine instructions and the contacts of public officials in charge. The application comes in handy when monitoring people in self-quarantine and making them stay in designated places. And contact tracing is an important part of the epidemiological investigation. Spikes in daily confirmed cases means heavy workload for epidemiologic investigators. So Korea Disease Control and Prevention Agency has been operating the system for the epidemiological investigation to ensure a fast and accurate analysis of a large volume of data. Well, as concerns are mounting about personal information protection, the KDCA is operating the system in a very strict manner. Only a few public officials are given partial access to the system, and it depends on their responsibilities and authorities. Look, our government is making efforts in many areas, such as R&D support for the development and of treatments and vaccines of the COVID-19. RNA research team from IBS completed the analysis of RNA transcriptome, which is generated by in-host cells by SARS-CoV-2, which is the cause of the COVID-19. Treatments and vaccines are imperative to root out the COVID-19. Drug repurposing is about finding out existing drugs that can work on the COVID-19 treatment. The repurposing can be applied to patients after swift clinical trials because existing drugs had previously proved to be safe. So the government has created a discussion body engaging industry, academia, researchers to swiftly start to conduct drug repurposing research. For example, a Pasteur Institute in Korea found out 20 drugs that have excellent medicinal efficacy among 2,500 candidates, and they are going through clinical trials which is effective and can be applied directly to the lungs. Our government has been opening research results and data shared to respond to the COVID-19 to cooperate with the international community. The COVID-19 is highly infectious, and that means social distancing is very important in quarantine efforts. Our Ministry of Science and ICT has supported the spread prediction of COVID-19 based on scientific and technological information to help with policy decision-making. First, our ministry has created a network engaging experts in infectious disease prediction and open data on travel records based on communication records, overseas roaming information, and statistics on confirmed cases for free so that the data can be used for research for the public. Korea Institute of Science and Technology used such data and came to a projection that the domestic daily confirmed cases can be as high as 4,000 if there is no large-scale social distancing. This projection proves that the Korean government has taken appropriate and relevant quarantine measures and reminded the citizens of the importance of social distancing. The COVID-19 has shut down schools, meaning that students and teachers are going through unprecedented difficulties with online learning. Korea has 8.1 million students, including K-12 students. So the central government, local government, communications service providers, and ICT companies such as Samsung, LG are doing their best to support online learning. Well, the examples I shared this time prove how effective the responses from the Korean government were. But we think that it may be difficult to apply our COVID-19 response model to other countries due to differences in ICT and medical infrastructure. Korea will continue to cooperate with other countries by sharing our policy practices and other valuable experiences. Thank you very much.
Thank you so much for this very interesting presentation from a country which has been at the forefront of addressing the pandemic. And some of the numbers that you mentioned would be the envy of many other countries in the world. I note in particular from what you said, the importance of a proactive approach, trying also to anticipate future risk, and an emphasis on science, on technology, and on multi-level partnerships between the public and the private, and also between the state and academia and industry. So all this is really food for thought. I will open now for questions which you can put in the chat, and maybe Stella can help me in case I miss some of the questions. Are there any immediate questions for our first speaker? I don't see anything. Maybe Stella, would you like to comment at all?
Yes, I mean, I wanted to really thank Mr. Yoon Yong and to say that we have also identified in our research Korea as one of the best practices in a way in how the COVID-19 pandemic was dealt with, and the way experts were used. And I think you outlined that very nicely in your presentation. But could you tell us maybe a little bit more about what you said in the conclusion, which was that you think it will be very difficult for other countries to share the experience because of the difference in the ICT system and in your health system? Because in a way, for us, identifying Korea as a good practice, as an excellent practice, we would hope that there would be lessons to be learned also for other countries.
Oh, well, I'm not good at English, so it's very difficult to explain. But in our country, smartphone penetration rate is over 90%. So, and 5G infrastructure is already done. So we can use a smartphone application very actively. But well, I think other countries' infrastructure of telecommunication system is not as fast as our system. So yeah, it means that it's the meaning that I want to share. And medical infrastructure is also very good, has good quality in our country, our nation. So I've done my yeah. Thank you.
Thank you. I have two more questions for you. Your English is really excellent, so you don't need to worry about it. From the chat. So I think more and more questions are coming. So I will I will concentrate them, and then I will give you the floor in case you want to react. So Professor Grant asks, is it fair to say that part of the strength of the response in Korea lies in the capacity to use command and control responses that pool expertise in a structured way. We have seen in the UK how this has worked in the vaccine rollout. And what kind of facilities does Korea use for quarantine? What happens if people reach Korean airports, for example? Are people asked to quarantine in hotels? And the last one is a self-reflective question, I think. Would you do anything differently in retrospect, thinking now how you responded in the beginning? Would you change anything? And I'll give you the floor. Feel free to react to any of these questions.
Well, I'm reading it by a chat.
Yes.
Yeah, our nation is using facilities like, as you said, hotel and their own home, because many investigators are going home themselves to check the situation of self-quarantine. So we can use many facilities. And next question is
would you do anything differently?
Well, it is very hard to explain because I am just deputy director and I'm not I don't have a I am not a high level officer, so yeah, it is very hard to explain. Yeah, sorry.
No, I mean, you know, it's because your expertise is super useful for the rest of us and I think for the rest of the world. So we appreciate really hugely you being here with us today. I think we can let you go now, but thank you very much for your presentation and for your insights, and thank you for joining this seminar. Thank you very much.
Thank you all.
Thank you. So now we continue. We have three more excellent panelists. What I propose now is to give them the floor in sequence and then to leave some time in the end for questions that can be addressed to the panel in general. So and I should say something that I should have stressed from the beginning, that just to let you know that the session is being recorded. I know that you have filled in your consent forms, but it never harms to repeat. So without further ado, I'm delighted to introduce Professor Koleka Miltsana, who is the chair of the Ministerial Advisory Committee for COVID-19 in South Africa, and who can share with us her experiences from the ground. Please, the floor is yours, Professor.
Good afternoon and good morning to everyone. I'm hoping that you can see my slides and they're showing well. Okay, thank you very much. And let me really just thank the organizers for actually inviting me to present some of our experiences in South Africa. So I'm a medical microbiologist by training, and at the moment I am the executive manager for the Academic Affairs, Research and Quality Assurance, shortened as AQUA, within National Health Laboratory Service. And National Health Laboratory Service is actually an organization that provides pathology services to all public health facilities of the country. And I've just been recently appointed as the co-chair of the Ministerial Advisory Committee for COVID-19. So what I thought I will do is to just give you a quick overview of how the country has actually responded to COVID. And I think this just illustrates the bodies that are involved. We've got the presidency sitting there, and obviously the Minister of Health and the Director General of Health, they are overseeing, because this obviously is a health issue. And below this, we've got the between the Minister of Health and the Presidency Office, we've got the National Command Council. And then on the one hand, we've got the various technical bodies. And that is where the Ministerial Advisory Committee, fits in that we provide advice to the minister and the DG and the Ministry of Health as a whole. And then the minister would have, the project management office, which then, the hands and feet of is actually the incident management team, wherein most government officials sit in to plan for the rest of the country, and they obviously would provide provincial support. So we've got the national team there that then provides provincial support, and they'll have different work streams depending on what needs to be done, whether it be at EP level, whether it's at clinical resources, as well as, human resources, so that different work streams. And then you've got your national, joint operations committees and provincial ones. So that's basically the infrastructure of the response as a whole. So just looking at the Ministerial Advisory Committee, the minister actually established this committee in April 2020. And the first minister, MEC, we call it MEC, the first MEC actually comprised of 51 committee members, which was a huge committee. And it then was subdivided into streams where we had a clinicians group that was led by one of the infectious disease specialists. I led the laboratory and pathology subgroup, and then public health was led by Professor Madi, and then the research group was led by the director of the Medical Research Council of the country. So, as you can see that, the MEC is really comprising of various expertise, scientists, at various levels. And then there was a change in the structure because it was too big a structure. Around October, a smaller MEC was established, and with this MEC, actually, the minister drew in ethicists, social scientists, and community leaders into the MEC to broaden the scope of the MEC. So currently, as I said, I was just appointed last month actually to co-chair now the MEC on COVID. We actually have got 3 advisory committees to the minister. Is the one general, that actually gives advice on COVID generally. And then he also has created a vaccine-specific MEC, and there also is a social behavioral MEC. So really what we are responsible for is to give advice on whatever issue that the minister or his team might be requiring advice on. And what has happened really, we have seen since the start of the pandemic, we have seen, the minister holding national webinars on national television with the MEC, where there would actually be various expertise from the Ministerial Advisory Committee just to give general education to the nation. There also have been major scientific announcements that have been made by the scientists together with the minister. For instance, a few examples would be when there were an announcement of vaccine trial results and how those results affected or impacted the country. Even when we had the emergence of the new variant, beginning of December, there was an announcement that was done by the scientists together with the minister. And we continue to provide and prepare media statements, for the minister whenever there's need. Very briefly, how the process goes is that the minister will request an advice or the DG, and then it comes to us as the co-chairs. This is where the MEC would actually operate, in that within the MEC, we divide ourselves into technical working groups, depending on the expertise that's on the MEC, and they would deal with that particular request. And then once that has been drafted by the working groups, it comes to the big committee. And from there, once everybody is fine, that advisory is prepared and it gets signed off by the co-chairs, which then goes to the minister and the DG, and the minister will take it to the various bodies. And what we have been very clear about is that we just provide the advice, and it is really at the end of the day up to the minister whether he takes the advice or he does not, bearing in mind that once he has the advice in hand, he has got a few other bodies that he needs to take through, which sometimes will end up, to the presidency if there's a major decision that needs to be taken. So that's what happens. And then what will happen is that once the minister has then approved the advisory, it gets published onto a public website. Just to give people an example, we've actually, the MEC, the various, the different MECs have actually crafted more than 100, almost 120 advisories. And if you look at this, only 4 out of that 119 were really not implemented. And this may have been various reasons. Either the other bodies or the other ministries felt it would actually not be to the advantage of the country. But generally, the majority of those advisories have really been taken up, and there have been action, and there's been certain implementation that have actually followed those advisories. And as I say, these MEC advisories, would find it on the ministry website, and there's also a specific South African coronavirus website wherein you will find these advisories. Just shows you, I mean, the massive numbers. It varies from, whether it's role of antiretrovirals, during COVID, what are the legal issues. So you can see that it's a variety of advisories, and what the MEC would do would draw in any other expertise from the country should we feel that the expertise on the specific advisory is not complete, is insufficient or inadequate within the committee. Another thing I thought I would highlight as well is that the country has established a consortium specifically around the variant that was first described in the country, the B1.351. And what has happened is that since December 2020, there's this research consortium that has been established that has got different research priority groups looking at diagnostics around COVID. What's the impact of these variants in diagnostics? Then clinical picture and epidemiology, looking at the host responses and the vaccine responses of these variants, to the vaccines, and also virology and genomics as well. There's an established, genomic surveillance group that keeps on monitoring this, the virus, and just to ensure that we're able to pick up variants much earlier. And this just shows the national collaboration of how we get in this genomic surveillance, in that utilizing the NHLS, as I have said, which actually provides laboratory services throughout the country. So, these are the various labs which are within academic units, which would be the medical schools. So the departments of virology there are contributing to the surveillance, which gives us a wide spectrum across the country. And what then happens is that about 100 to 200 positives a week get actually genomic sequenced, and just to make sure that we understand what's happening and what's circulating in the country, and also looking at performing sequencing on vaccine trial samples. We have also started to support other the neighboring countries where we actually this group, this consortium actually assists with doing sequencing, and there are various other projects that this group is doing. So what actually happens is that then we're able to monitor, and should there be any changes, we keep giving advice to the minister, and sometimes make announcements to the to the country as a whole. And I mean, this just shows and tells you that it's a massive country collaboration, which has been very useful. The other area where that has been used has been, the NICD, which is National Institute for Communicable Disease, is actually a division of the NHLS, and they specifically look at surveillance and do epidemiology, and epidemiology, and this comprises of microbiologists, virologists, public health specialists. And what NICD has been doing is to provide support to the Ministry of Health, where they actually present, at the IMT meetings, which occur once a week. Initially, they were twice a week. And coupled with what NICD is doing, there's a hospital surveillance system that has been built, since the start of the pandemic, which really has allowed the country to be able to assess the morbidity, mortality that is bringing in the clinical side of things. And so this information is available, and it really is widely used by both the provinces as well as the National Department of Health, because it allows tracking of the disease, tracking of what is happening within communities, and even for that matter, looking at what real-time data that's available. And as a result, the provinces and the districts up to district level can generate daily line lists to monitor and manage the pandemic. And as you can see here, every a hospital, public hospital, as well as private hospitals within the country, all of them actually submit this data. So we've built this database, and it really has proven to be very important and useful in managing the epidemic. Another area that really has contributed quite significantly has been a consortium that was formed and established in March last year at the request of the Department of Health. So we've got modelers who have actually come together, and they have established this modeling consortium. And we have seen how this has actually been very critical. Even with when the first wave came, they were able to model what are the resource requirements that are likely to be there. And then when we went through the second wave, they were able to look at what are some of the factors contributing to the resurgence of this. And currently, because we are just on the verge of this third wave, and we're hoping it's not going to be as severe. So we're currently looking to see. So the group is looking to see what's the impact of these variants that we're seeing, these variants of concern, and obviously vaccination. What impact is it going to have onto the next wave? And I mean, they've developed a lot of data and dashboards that are currently being used, and these are the dashboards that are available up to district level, which will tell you if everything is under control. We look at the number of testing that's getting done, number of positives, what percentage is the positivity rate compared to the previous wave. As a result, it makes the implementers at the Ministry of Health have an idea, and they send you alerts. They can send you alerts that something is about to happen and when you should respond. And this has really been quite useful for the implementers within the Ministry of Health. And as I've already said, now we're looking at how these variants and the vaccines are likely to influence the third wave, should we get into the third wave. This is my last slide, and really I think it just brings everything that I have said, that we've got the Ministry of Health there, we've got the Ministerial Advisory Committee, we've got the NICD, we've got the modelers who are able to put all these things together, and we have clinicians, public health specialists, and the laboratories who really have rallied around and assisted in assisting the Ministry of Health to make the decisions. And we believe that this really has created a lot of trust from the public generally, because whenever the minister is announcing anything, or if there are new guidelines, even when sometimes the president is announcing, whether there's a lockdown or not, there's always the backing of the scientists who are coming from different backgrounds. And we feel this really has built a lot of trust. It's just a matter of making sure that this can be sustained as we continue to deal with the pandemic. Let me end there. Thank you very much.
Thank you so much for this really very, very important presentation. You highlighted a number of different things, how science and government interact, the role of science in enhancing public trust, which is very important. And I think it's an area of daily discussion, I think, everywhere. And of course, the importance of data and knowledge and up-to-date data and ongoing data and analysis in order to have the best picture that we have as we go along to address the virus and any variants that it may have. Thank you again so much. I think I will proceed to our next speaker now and leave some space for discussion afterwards. I hope Senator Kasanga is with us. It's a pleasure for me to introduce Senator Sylvia Kasanga, the chair of the ad hoc committee on COVID-19 in the Senate in Kenya. So the floor is yours, and it's wonderful to have you with us.
Thank you so much, Professor, and thank you, everyone. What an honor to be able to make this presentation. And I can see I'm the only parliamentarian in the panel, which means I hope you wanted to hear the experience of the parliamentarian from our angle. A lot of the presenters, of course, being in the executives or in their governments. I can say actually from Professor Koleka's presentation, that is pretty much what we had our government be able to do as well, how they rolled out. And when they came to us for their presentation on how they were handling, it was pretty much similar to what also Professor Koleka has presented about her country. But what a wonderful exchange and sharing this is. So from a parliament point of view, when COVID came into our country in March, Unfortunately for us, we were not part of the executive's steering committee that was in charge of this, and therefore Parliament felt the need to keep track with what the executive was doing by forming an ad hoc committee that was then established shortly after our zero patient was identified. And technically, we were just oversighting what the national and the county government was addressing and how they were going about rolling out their policies of handling COVID. So I had the honor of being the first vice chairperson and later the chairperson when our chairperson left the committee. Next slide. We handled our issues in a thematic manner because the mandate was very wide. We had to split it into the health issues, which were the overarching issues. We had to look at the economic and finance issues. We had to look at the social order and human rights issues because of mostly lockdowns. The lockdowns that were instituted, we needed to look at this. Access to food, water, and other basic commodities, because we have a lot of vulnerable populations and we're worried that the lockdowns then would cut them off. And this was very critical. And then we had to look at the support services and cross-cutting issues. And specifically, ICT. ICT played a very key role in communication and getting business back up and going once the first 100 days of strict lockdown were done. Next slide. And our mandate, of course, starts by a review of the policy and legislative interventions. And unlike many other governments around us and maybe internationally, Kenya in the modern day has not had to deal with a pandemic or an endemic of this sort of magnitude. And therefore, it was our first time. And we had to really look out into how then to handle this thing in a holistic sort of way. And therefore, the committee developed the Pandemic and Response Management Bill that we sought out our stakeholders through the submissions that were done mostly online. And we were able then to get a lot of feedback, and a lot of research was also done by our teams in Parliament to look at how other jurisdictions have handled these issues. And therefore, we're able to draft this bill and also send it out further for our stakeholders to bring back their views on how then should we as a country handle a pandemic in the near and foreseen future, and should it happen. Next slide. We had a lot of information that was presented to us as well by the government ministries. And as usual, our work is to look out for what they're saying as opposed to what exactly is happening on the ground. And therefore, we had a lot of stakeholder engagements with the people on the ground, also just to hear that actually what the government was doing was happening on the ground. And we did this through first responders, frontline workers, just to get a picture of what is happening also on the ground. You can proceed. We undertook site visits as well. Again, this is because mostly that the national government and the county governments were clear on some of the things that they were doing, but we felt that we had to go and see it for ourselves, and would meet with the respective committees at national and also at the county government levels, and would also meet with citizens just to hear, and would inspect the health facilities to see how their preparedness was going on. And our overall observations, of course, protective kits were a big issue along the counties, and ICU units were still an issue around the counties, in as much as a very rosy picture had been painted. And we had to really push these governments, to keep up, because we were monitoring as the spread of COVID was happening, and we were worried that once the lockdowns would be released or relaxed, then there would be quite a spread up country and into the counties. So it was important that the county governments be pushed so that they may prepare for this eventuality. And it was wonderful that the national government had given enough guidelines on home-based care. And for us as legislators was to ensure that our citizens down in the counties and in all other jurisdictions within the country had received these guidelines and that they were being educated on them. Also, we acknowledge the role of the private sector, which had come in very strongly to work very closely with the county governments to help with, relieving especially the vulnerable communities. Next slide. We had, of course, very many challenges, considering there was lockdowns and there was no movement and a lot of things were grounded, but we did manage to do the little that we could do at that point in time. And we did use a lot of course, resources were used in this sort of thing, but we went into the ICT space, went into a lot of virtual engagements to be able to get as much evidence as possible from the ground, and to corroborate that with a lot of online meetings with the government, with the response teams and their subcommittees, just to see also and exchange notes and see where also we can come in as citizens to try and help the national government if there was an issue with the rolling out that was happening. A lot of disputes, of course, came in, starting, of course, with the healthcare workers and how disgruntled they were with various of the other issues. We had a lot of questions from other members of parliament they were raising from the reports they were getting from their citizens on the ground. And of course, as part of our oversight role as parliament, we had to request for special audits to see how the government was actually expending on the issue of COVID. We have to realize that parliament had passed supplementary budgets at a national level, and our committees, our county governments had also passed supplementary budgets, all going towards the fight against COVID. And so we had to do the oversight role by using the instruments that we have of control of budget, Auditor General, and the Ministry of Health and others, so that we can make sure that the funds had been used properly. So a lot of reports were tabled to us for us to oversight. And then a lot of questions also were sent out to the various leaders to answer where we saw that there was a red flag. Can we proceed? So a lot of our work, of course, was informed by the data, evidence, information, and also human impact stories. But I have to really stress on the importance of ICT to help us roll out, because all this was happening in the first 100 days of COVID in Kenya. And one of the things that the national response team did, which we really thank them for, was the immediate institution of a lockdown, first to contain the spread and allow the county governments to increase their capacity in the healthcare sector, increase their ICU units and capacity build with the healthcare workers, as well as oxygen, increase their oxygen output capacity within those first 100 days. And this worked out very well, but it came with a serious economic impact, of which then the government was forced to begin to release the lockdown gently as they monitor how the virus was spreading. Next slide. So therefore, I have to say from a Senate side and a parliamentary side, we in the end had to work also very closely with the national response team to answer all the questions that were coming from the citizens from all the various thematic areas that we had identified. And I have to say now, even as we go through the different phases of COVID, because we are roughly on our third phase, which the government has already reported that by July this year, we should be seeing probably the worst of our third phase. We are monitoring the situation very closely. We are aware that vaccines are going to be a challenge. I know the subcommittee that is advising the government on vaccines is having to now source for many various suppliers of vaccines to come to us. And testing now at least is much better than it was at the same time last year. A lot of capacity building has been done on that. And although the challenges are there, we are managing. The economy is fairly fully open. Maybe just a few entertainment and recreational and tourism sector, which has been greatly affected, is still lagging behind in opening up. But largely that was our experience as legislators here in Kenya. Thank you very much.
Thank you very much, Senator, for this very, very interesting presentation. I'm very grateful to you for raising the importance of parliamentary scrutiny, which is essentially a rule of law issue as well. I mean, we have been discussing a lot the relationship between government and science, but I think the question of how parliament can influence also government policy, it can scrutinize government policy in a transparent way, in order also to inform citizens, is hugely important. I think there are very big questions across the world and in Europe especially on how transparent government decisions have been and whether parliaments had effectively an oversight or an approval of key policies, including measures which were quite restrictive for citizens. So, I'm very, very grateful for you to raise your involvement from a parliamentary perspective. I think also in terms of this project, I think it's very important to highlight the role of parliaments. And I really appreciate your efforts also for fact-finding on the ground, which again, parliaments perhaps are best placed to do. So thank you so much. And I'm sure there will be many, many questions for you in the debate. But for now, I would like to hand over to Professor Caroline Mandel, Chief International Science Envoy at the Foreign Office. to hear about perhaps the UK experience and also the external and global experience of managing the pandemic. So Professor Mandel, the floor is yours. Thank you.
Thank you very much, and hello. It's a great pleasure to join just the distinguished speakers on this panel, and it's been fantastic to hear about the efforts in your countries. And it's difficult to add to that, but what I'd like to do is give you a broader sense of the UK ecosystem for science advice to government in emergencies, and in particular, how that has been applied and how we've evolved that over this past year. And I think what's come over, particularly from the talk so far, is the fast pace. And I think Professor Kalika mentioned about it being quicksand, and I think that's a fantastic analogy at the rate at which we've had to step up infrastructure and systems on a multi-scale basis, but also to be incredibly dynamic as we've learned more. Just over 1 year ago, we knew very little about this virus as we were receiving the first notifications from China. But let me step back to begin with and give you a sense of the science advice and policy ecosystem within the UK, which is long-standing and has been used for a number of emergencies, and then I'll apply it to the COVID crisis. So we have a mechanism called the Science Advisory Group in Emergencies. This is actually a mechanism rather than a standing membership group that can be stood up by the Government Chief Scientific Advisor. The Government Chief Scientific Advisor, currently Sir Patrick Vallance, is the Prime Minister's Science Advisor. So if the Prime Minister has to deal with an emergency that's of national importance or major disruption, he can convene his Cabinet Committee and he can draw in the Government Chief Scientific Advisor if that crisis requires scientific advice, which often it does. Sir Patrick, in his role as Government Chief Scientific Advisor, can then choose to trigger a number of mechanisms depending on how complex the situation is from a scientific perspective and how wide and diverse advice he needs to draw from across his networks of scientific and logistical advisors, as was the case for COVID. Sir Patrick chairs a network of government science advisors across Whitehall. I previously was the Chief Scientific Advisor to the Foreign and Commonwealth Office before taking on the International Envoy role. And we form a network that supports Sir Patrick in his work and also the science advice within each of our Whitehall departments, whether that's trade, whether that's health, whether that's the Foreign Ministry, whether that's innovation and science and business. And so each of us have our own departmental remits, and we meet on a weekly basis to share best practice, to talk about science strategy, and to compare and support one another in our work that's interdisciplinary and also interdepartmental, and then our connections out into business and academia and the wider research and innovation base. And so Sir Patrick has this mechanism called SAGE. He can scramble that and pull in the kind of experts that he needs to address the particular crisis for which he has to give science advice. And so in the middle of January last year, when the World Health Organization notified the world about this new emerging disease in China, Sir Patrick brought together a wide range of experts, both across the health perspective, epidemiology, virology, the relevant chief scientific advisors, and also the public health perspective and a number of the logistics services and a wide range of other experts. The SAGE mechanism also has a number of subgroups that feed into this, and this is really important that these subgroups are able to draw together the right experts to work on a particular subpart of the crisis. This is a place where expert academics can actually battle with one another, if you like, around the scientific method. They can present their results to one another, they can test one another and challenge one another's underlying assumptions. And it's really important to have that safe space for them to do that piece of work. And that's been incredibly important through this COVID pandemic as we've evolved that science advice. And it's important to say that that government science advice mechanism in SAGE does not make policy, and we do not make political decisions. So it's very important that the science advice is passed through to the policy teams. We provide the best possible evidence base as it evolves to the policymakers. The policymakers then formulate the relevant policies with that advice, and they put those policy scenarios to our ministers. And it's our ministers that make the final decisions because, of course, they're our elected representatives of the country, and they're the ones that make the final decisions, balancing across all of the policy challenges. The importance of that multidisciplinary and wide-reaching SAGE mechanism is that we were also able through the pandemic to really advise across government, particularly through up to Treasury, so that Treasury were then able to put in place the right kind of financial packages, not just to support businesses, but also to support individuals when they needed to self-isolate. And all of that was evidence-driven and research-based. And so when the SAGE mechanism was first triggered for COVID back in January, it was very clear that we needed to put in some very widespread surveillance systems. We were stepping up our testing system. It was actually really important that China had made the full genomic sequence of the virus available internationally. That allowed scientists around the world to very quickly be able to start to adapt the assays for their tests, and also to look at therapeutics and to start to do their work on vaccines. And again, you know, testament to the scientists around the world who not only have provided one vaccine, but a suite of vaccines for us all to use in our countries. I don't think that any of us on SAGE at that time really could begin to really imagine that we would have this level of hopeful development just, you know, 1.5 years on to have all of these vaccines in play. So that's a positive that I think I would keep through this. But throughout this, I've been absolutely, you know, overwhelmed by the 24/7 work of our scientists and our innovators working together and reorientating all of their research programs to make sure that we can tackle this crisis nationally and globally. And so really that whole system was put in place. We have a water surveillance system looking for infection in wastewater. We have the Office for National Statistics, so already, you know, well-standing systems in place. The Office for National Statistics put a countrywide random survey out. This was very important surveillance system, which has grown in importance through the pandemic as we started to see randomly how to sample where the virus is actually spreading, and also to combine that with genomic sequencing. In the early days, of course, the value of that was not fully visible, but it is now, because we have a very complete and understandable data set, so that we will actually in the future be able to look back and analyze also what has happened over the course of the pandemic. I mentioned genomics. We have 16 world leading research groups in our universities on genomic research, and they were pulled together under the guidance of Professor Sharon Peacock at Public Health England, and very quickly convened together to make sure that they could start to look at the genomic sequencing of the tests as they were coming through early in the pandemic. This has proven to be incredibly important for our ability to find new variants, and as we've heard already, variants of concern are a real challenge for the continuing management of this pandemic. And we made the genomic sequences publicly available. So I believe that the UK genomic base contains something like 50% of the world genomic sequences of the virus. And it's incredibly important that those data are made available publicly so that scientists around the world can really use those in their analysis. And that open data sharing, that culture of open research, is something that the UK has a strong reputation for. And we've been encouraging other nations to do the same. And until everyone is safe, we're not safe. And so it's been very much that culture of open sharing. Similarly, the ecosystem of rapid publication, again, something that, you know, UK agencies were pushing very hard for, and working closely with the publication sector to make sure that we would have an open, rapid peer review process for publications. And it's been incredible to see the ramp up in those research publications coming through since the beginning of the pandemic. And then, of course, the other thing that our experts have been able to do for us is an evidence synthesis, because as the amount of research and the number of papers that have been published has ramped up almost as exponentially quickly as the virus spread itself in some cases, it's been quite difficult to keep hold of all of that knowledge. So that knowledge curation is something that SAGE also provides, and actually reaching out into our communities of experts and bringing that evidence base and the synthesis of that evidence and the insight that it gives us, so that we can continue to adapt our process and our response to the pandemic. The UK also has been instrumental in working with international multilateral systems. So, for example, CEPI and Gavi and the COVAX mechanism to help to deliver vaccines to countries around the world. We were very fortunate that because of investment over many years into our life sciences research base, we were able to produce one of the leading vaccine candidates very early on. And it's been a real testament to the University of Oxford, Professor Sarah Gilbert's team there, and their work with AstraZeneca to actually roll that out at scale. And I think sometimes it's not necessarily fully understood how difficult it is to go from one vaccine in the laboratory. We think that's the great breakthrough piece, which of course it is, but to go from that to the scales that we need to vaccinate the population of the world, you know, to go to billions is the big step up. And of course, the other thing that UK government did in a very coordinated and strategic way was invest in the vaccine infrastructure. And so the innovation just in terms of getting, you know, a paddle that will actually stir that vaccine soup and not destroy the molecular biology of the vaccine in order to get that into vials at scale. That's also something that's quite mind-blowing when you hear the expert engineers talking about the infrastructure challenge of stepping up vaccine factories at scale on such a short time scale. But they managed it, which was incredible. And the investment, and that stable investment from government, was really at the heart of enabling those companies to do that. The COVAX mechanism is an international way of sharing vaccines. It's something that the UK has put real money on the table for, not just in terms of promising whether we would provide vaccines, but actually putting real cash on the table. We also put money on the table to encourage other countries that may not be able or in a position to put so much money on the table. So the higher and the middle income countries, encouraging other countries to match fund our funding. And the idea of that is that we can then provide equitable access to vaccines around the world. And that takes away some of the vaccine nationalism that, of course, would then limit the ability of us, the whole world, to really deal with this pandemic. And so again, that's been a very inspiring piece of work. And the Prime Minister brought together world leaders in June last year for the Gavi conference to agree to make sure that we could actually deliver as a world the vaccines to the countries as they needed them. So that work continues. And then finally, of course, it's sharing of best practice internationally. And the map, I think, that the team have produced here is really important to actually see where the science advice mechanisms to government lie around the world. There is a growing network of government chief scientists around the world and other countries approaching the UK and asking for advice on how to set up science advice mechanisms in their countries. And so those government chief scientific advisors are also connected, sharing best practice. There is a network of government chief scientific advisors convened by the US that meet regularly. There is also a parallel network of foreign ministry government chief scientific advisors, which also meets in parallel. And this is a great way for those science advisors who sit at the heart of government to be able to share best practice and compare and connect with one another and connect their communities back into their nations or outwards together with one another. And finally, just to finish, I would like to say that, the UK, of course, in tackling this pandemic, we have many lessons to learn, and it's been very humbling listening to the infrastructures put in together in other countries. I know we've connected very much with Kenya and South Africa and South Korea, and our ambassadors in country have been central in helping us to make those connections with collaborators around the world. We have a network of 100 science and innovation attaches attached to our embassies around the world, and they're really central to helping us to connect with the scientists, the scientific experts, and the ministries in country so that we can all share best practice and make sure that we tackle this pandemic as soon as we can. Thank you.
Thank you so much, Professor Mandel, for this very, very insightful presentation. I will keep 3 points, perhaps as a bridge to Dr. Ladi's intervention now. The first one is that you mentioned a safe space for scientists to discuss their arguments and their disagreements. And I think this is very important. I think we mentioned the legitimacy and credibility of scientists, but the public may also have to be educated that science does not mean only one view, that it's not something homogeneous, and that the disagreement is a part of life in a sense. So, I think it's very important to provide avenues for that people can speak without being self-censored in a sense. And this relates to the second point, which is that obviously you do not give policy or governmental advice. You make the science and the views known, and that's for the government to decide. And the third point, of course, is the importance of collaboration. And I think scientific collaboration globally has been really amazing and has provided the solution. Sometimes we talk about vaccine nationalism, but I think collaboration in a global world for a global threat is really the key, as is collaboration between you and your counterparts. So thank you so much for these points. Now I'm going to hand over back to Dr. Ladi for her first reaction to her presentation. And then I think it's only fair that she leads also the discussion, because I'm sure there are already many questions for the panelists. So Stella.
Yes, thank you very much, Valsamis, and thank you all for the wonderful presentations and all the new elements that you brought to us. Unfortunately, time is flying because everybody spoke a little bit longer. So maybe I would just ask you to turn on your cameras if you want, so that we are all on screen and to have very few questions here. since I promised that we will finish on time. And maybe we'll start with a question that we have for Professor Coletta Milsana from our colleague, Fernando Barrio. And if you can briefly address the question about legal advice as a separate advice, as a separate kind of expertise that was used. The question is, was there only legal advice for the impact on rights of the policies, or in addition, the biological and medical advice had an interdisciplinary treatment, so the recommendation included the previous legal analysis when presented to the government. And I'm just checking to see if there is something else for Professor Coletta. There is also a general question here that you may want to talk about, which is about the COVAX effort and how can this be funded, if you want to add something about the COVAX effort. And we see if there are any more questions. Thank you.
Okay, thank you very much, Stella. And really, let me just clarify. Actually, that was just one of the advisories that were asked, from the ministerial, from the ministry to the advisory committee. And this was a specific advice. And the idea then and the challenge that we're facing was at the peak of the pandemic, where healthcare workers were working under very strenuous, conditions. And the question was, how could we then mitigate some of the legal liabilities that they may be faced with? So we needed to help advise the ministry as to, especially when sometimes there's high rates of absenteeism in the midst of heavy demands at clinical level. There may be errors that happen, there may be mistakes. How then does the state protect the healthcare workers? Obviously, as long, in situations where there's been no negligence, obviously. So it really was to give advice as to how best could we mitigate, those, legal liabilities. Thank you. Insofar as how to boost COVAX effort, really, maybe let me not respond there, because obviously funding often becomes a critical issue, as well as availability of vaccine doses at the moment and how that distribution happens. And in fact, for us as a country, maybe the contribution I could just make is that we found ourselves faced with a challenge where, because sometimes you cannot choose what candidate vaccines you can get from COVAX, and you find that actually some of those candidates may not necessarily be the best candidates for the country, as we saw, earlier on, when the first results, of AstraZeneca came in, which put the country in a very difficult position. So I think really, how we interact with the resources, through COVAX, a lot of issues are going to be taken into consideration, and funding being one of those, and the distribution thereof, once those resources become available. Thank you.
Thanks. And before we answer a question that is related to the project, I'm wondering if Professor Carol Mundell or Senator Sylvia Moenika-Sanga would like to add something on the COVAX question, because I think this is a question that really was initiated by your contribution, Professor Carol Mundell, and it relates to all of us, yeah?
Yeah, I'm very happy to comment. And I think it's right, Professor Kolka makes a good point that it's not just the money. Because it's also about the market agreements, it's about the volume, it's about enabling and supporting the companies to produce those vaccines at volume. And the goal is to have 2 billion doses ready by the end of 2021, so that 92 of the lowest income countries can have access to those vaccines. So some of it is about, I guess that, countries like the UK really leading by example. So we did put real money on the table in significant quantities, but we were also in a position, I think, philosophically, to be able to make that point about equitable access to vaccines, because we did have a vaccine candidate. You know, it can be quite difficult if you don't have a candidate vaccine, you don't have the systems in place to say, oh, I think we should all have vaccines. That's a good message, but actually, how do you land your voice in the international diplomatic community? But because we did have those assets, we were in a strong place scientifically and logistically, we were able to lead by example. And I think that's something that we're keen to continue to do. But also what I've been incredibly impressed by is the quality of the publication of the vaccine trial data and the transparency and the use of the medical agencies that actually do the registration and the reviewing and the approval of those vaccines. And that's something that the whole scientific community, I think, have been very strong in making sure that everything is published, and we are incredibly transparent, because that's absolutely critical to address vaccine hesitancy and to keep the public trust in those vaccines in place, so that we are transparent, we are working closely with our medical professionals, and we're doing that in every country and communicating in a way that is separate from any political conversations that may become tense, that actually we go back to the science, we go back to the evidence and the data, and we continue to push on those trials so that we can get greater and greater understanding. We have so many different new vaccine technologies in the suite of vaccines that we have, that it's an unprecedented time for us, I think, in terms of a pandemic. If this pandemic had happened 20, 30, 50 years ago, I think we would be in a very different position. So it's very positive, but we need to keep that open collaboration, the transparency, the robustness, so that the public don't lose trust, because to have vaccines that work and to have people not trust in taking them, I think would be a new catastrophe.
Thank you. I don't know if Senator, you would like to add something, or should I?
No, maybe just to appreciate what Professor Carol is saying, because one of the biggest challenges we've had with the rollout of the 1.2 million AstraZeneca vaccines that landed here through the COVAX program is a very slow uptake. And that is because of the lack of trust that you're talking about. And there's so much information now. A lot of our citizens have access to, the internet and information. And because of the different and negative comparisons that are coming of the different kinds of vaccines, is causing a lot of people to hold back from taking their vaccines. And the rollout has been very, very, very extremely poor, which is really sad. So that kind of messaging, I think, is very critical. It's very critical that, all these manufacturing companies need to start messaging something together, so that, it's not a matter of competition, but more of, getting a solution globally. So I think the work that Professor Carol is doing, and that message is really well taken home. Thank you.
Thank you. And maybe from that, and because you mentioned the importance of trust, to pass it to one of my two very, very good colleagues and collaborators in this project, to say maybe a few words about the survey, because we have a question about the survey and whether we looked at trust and experts. I don't know if any of you two would like to say a couple of words about that. It's a question by Katerina Sideri about if we looked at citizen engagement, deliberation, and the link to public trust and expertise.
Angelos, okay, I will start. So a part of our project was actually to look into public trust. So we commissioned a survey to 4 out of 24 countries that we investigated. And our questionnaire involved questions about trust towards governments, towards the expert community, towards vaccines more broadly. We haven't actually really analyzed our findings. This is something that we will do in the next couple of weeks. But of course, it is an important question, and we have looked into this. We are just not really ready to share our results.
But hopefully we will do soon in articles or something else. Yes, Angelos, you want to add something, and then I will close the session.
The question speaks about citizen engagement and deliberation. If I understand this correctly, our questionnaire and survey does not really actually look whether citizens were somehow consulted vis-a-vis the sanitary measures. I mean, in our mind and in the mind of most governments, this is a question about experts and governments and, what works better in terms of managing the crisis. So, this is something that it's not really within the scope of what we're doing. Having said that, we try to capture how much, there was a two-way street and interaction between government and citizens, how this affected public trust, but not, in a direct way, let's say, citizen engagement or public dialogue on the sanitary measures. Yeah, that's it.
And quite a lot on what we were talking just before, which is trust in the vaccines. So we try to question whether the use of expertise can enhance vaccines, trust in vaccines, and communicating via experts could help. I would like to close it slowly and thank you very much for all the contributions. Just to say that there were also 5 policy associates in the Global Policy Institute that also helped us with finding data all around the countries, all around the globe. Some of them are here with us today. And once more, thank GPI Professor Colin Grant for giving us the support to do this project. We will come back to all of you, maybe to ask you more questions about your experience from the countries. And we will, if you would like to send us your presentations, if you don't mind, if we can share them with the other speakers. I think they were very, very useful. So thank you very much. I don't know if Valsamis or Colin want to say something. This is it for me.
I would just like to thank everybody. This is really a fantastic seminar on a fantastic project. So thank you.
I'll just endorse those comments by Valsamis. Wonderful to reconnect with Carol, and so important to hear voices from 2 countries in Africa. Thank you very much.